We've already taken care of tennis elbow, so now it's time for its cousin, golfer's elbow. Not as popular, but also definitely seen with any sort of gripping motion, repetitive, strong gripping motion, like in throwing sports or racket sports, or with professions like carpentry or plumbing or construction, can all really affect these flexor muscles and tendons. So we're going to try to do some massage techniques to calm that down. Now, the best thing that you can do is stop doing the activity for a while that's actually causing the damage to the tissue. Now, usually about 2 weeks, give or take, depending on your condition. However, if it's part of your profession, I know that's very hard to do. So you want to just minimize the amount of time that you're irritating those muscles, and when you're not working, really taking care with rest, self-massage, stretching. If you're in physical therapy and getting massage regularly, that's plus, excellent. So I'm going to teach you some things to do on your own now to really take care of it. So just start out by squeezing. And now I like to rest my forearm on my leg like this. I put a pillow because sometimes it's too much pressure for you. If you kind of relax your elbow on your leg, that could be too hard. So a pillow is good, or you can lay it on a coffee table, maybe like the corner, because it's good to have your hand off so that you're free to make hand movements with this, and you'll see what I mean. So nice, gentle squeezes. Leaning in. Now notice I am hinging at the hips to lean my body weight in. I am not rounding over like this, which is not going to give you a good pressure that you'd like and hurt your back. So you want to sit up straight and just hinge at the hips and lean in with your body weight to apply pressure. And I'm just going from the elbow to the wrist. Now let's repeat. And we can repeat with some movements. So we can repeat by doing pronation and supination. So you're grabbing the fascia, the muscles, the tissue, and going palm down, palm up. Palm down, palm up. Take a nice deep breath. You always want to remember to breathe through this. Nice, deeply relaxed breathing. That's in through the nose and out through the mouth. Great. Now we're going to start at the elbow crease, and we're going to use our forearm of the working muscle. So it's a nice broad pressure. Lean in, hinge at the hips, lean in. And we're just going to start a myofascial release technique all the way down from elbow to wrist. Myofascial release means that you're not pushing it, you're not forcing it, you're not sliding over the skin, so you don't want to have a lot of lotion or moisturizer or cream on your arm with this. You really want it to be free of those things so you can engage the tissue and just relax as it releases. Exhales really help with the release, so take a nice breath. Exhale, relax the arm even more. And just let it work its way, melting the tissue all the way down. I'm just leaning my body weight. Great. Let's do it again. And this time we'll add some movements. So engage the tissue, lean in, get your grip there. And then let's start with wrist flexion and wrist extension. You're going to feel the stretch on the wrist extension. Flexion and extension. Now only do this if it feels okay. You don't want to be in pain while you do this. You only want to apply as much pressure as is comfortable, and only add the active movements if they're very tolerable. If it's a little bit uncomfortable, that's fine, but no more than that. So if it's too uncomfortable, then just stop the movements. And you can also lighten up on the pressure just by backing off with your body weight, and you can apply more pressure just by leaning in more. That's great. Now we're going to get a little more specific with the pressure by using knuckles. So you're just going to make a soft fist, not like this, just soft, and you're going to be using the muscles. We're going to start at the wrist. Again, myofascial release, nice and slow. Grip the tissue, bring your wrist up in flexion like this to grasp the tissue over here. Grasp the tissue. Engage, and then again start to make your way up towards the elbow crease and slowly stretch it out because it's going to stretch. So you want to move nice and slow with these techniques. Really take your time. And you can add even more stretch if you want to, if it feels okay, by extending the fingers back when you extend the wrist and by curling them in and making a relaxed fist as you come up. You'll feel the difference. And back and curl it on in. Slowly stretch, keep this real slow. No sudden big movements. Deep breath in through the nose and out through the mouth. All the way up to the crease. Okay, we're going to locate that common flexor tendon. I was so used to doing tennis elbow, but this is a common flexor tendon, which is on the inside, the side facing you, your body. And you're going to find that big lump, that bone. That is your medial epicondyle. And right below it, you're going to have a big tendon where all of those flexor muscles merge together. It will probably be very tender. So what you want to do is apply about 3-4 fingers to the area, palpate around a little bit, see where it's really tender, where sort of the tissue seems to be the most disrupted. Apply a little bit of pressure, don't kill yourself, go easy. And then we're going to do some friction, and that means you're going to sort of snap over the tendon and then gently relax it back. So you're applying pressure to go over the tendon. It'll almost feel like strumming a rubber band maybe, and gently back. You don't want to strum it both ways because that's just too intense. So you just do it that way, and then you can start taking it in different directions. So this is friction. We're going in multi-directional friction here. And this is really great for promoting healing. It can be intense, so take it easy. If it's a little uncomfortable, that's fine, but really tolerable. You don't want to hurt yourself. So I'm just doing all different directions. You can pay more attention to the areas and the direction where it feels like it needs it the most. And just do this for a minute. Take a deep breath. If this is kind of intense, breathe more. Relax the tissue on the exhale. You can probably see me kind of snapping over. Okay. Snap, snap. And if it's too intense, skip this part. It's okay. All right. We're going to follow this up with 3 eccentric contractions to stretch it out. It's a little tricky, so stay with me here. You're going to flex the wrist and the fingers. Well, let's just start with the wrist. That's enough. And you're going to press with the other hand, with your working hand, you're going to press against the affected hand. And you're going to have a little bit of instead of an arm wrestle, a hand wrestle, if you will. So you're pressing them against each other. Now the working hand is going to overpower the affected arm by just a little bit. So it'll just start to slowly move the hand down while this bottom hand is still resisting. It's resisting, but the top one is pushing a little harder and going all the way down until you have a good stretch. Then you can release the little tug of war there and come on back up. Again, press back with the bottom hand, but press a little harder with the top hand. And you'll be on your way, nice and slow. Really give it that resistance. As far as it'll let you. Okay, and now we can add in the fingers a little bit. So you'll be curling the fingers in. So first you want to push to extend the fingers and then continue to extend the wrist. Excellent. Shake it out a little. All right, now let's just find any points that feel tender or you feel like we missed or didn't address. You can use your thumb for this, or you can kind of explore around just using your fingers, 3 or 4 fingers here. Palpating, making little circles and just seeing what's a little more tender, what could use a little more love. And if you find a place that feels like it needs some work, just stop there. Lean into it as much as is comfortable and take some nice deep breaths. In through the nose, out through the mouth. And you can also find a place, lean in with your pressure, and give it some active movement. So flex, extend, or you can make wrist circles if you want to. Just whatever feels good here. Remember, when you go back like this, you're giving it a good stretch. You can massage it a little, do a little circular massage. And let's move on down, might as well, to the palm. Give the palm of your hand a nice massage. Cover the whole thing. You can do lines like this, going from the palm up towards the fingers. Give that thenar eminence, that big thumb pad, a nice squeeze, a good pressure there. It's probably a little tender, it is on everybody. All of our electronics overwork our thumbs there. Give your fingers a little massage and a little traction. Pull, massage, kind of twisting it like I'm twisting a cap off a bottle, and pull. And pull. This should feel pretty nice. It's nice to open up those joints. Let's give it one more nice big stretch. Just like that. Breathe. And let it go more with the exhale. And shake it out a little. And just rest your arm down. And take a moment to notice how it feels. Notice any difference between before and after your massage. If it feels a little activated, then that's totally normal because we did a lot of massage techniques. That'll calm down really quick, but it should feel more relaxed and hopefully you have less pain. And if you practice this pretty regularly, or even just take a couple of the techniques that you think work best for you and do it a couple times a day, that should really help. The more you need to do the perpetuating activity that makes it worse, the more you want to do this. It's great afterwards, after the muscles have gotten irritated for some time. Go ahead home and do some of this nice self-massage, do a little bit of the stretching, and relax the area. If you liked this video, give me the thumbs up and subscribe for more. Comment below. Let me know how this goes for you. And if you have any tips or tricks for tennis elbow, let us all know. I'll see you in the next one.